In this video, I'm going to give a brief explanation of myofascial dry needling. In summary, dry needling is applied to minimize or avoid the use of ischemic compression techniques. Ischemic compression techniques is also known as deep tissue massage. We want to limit the use of ischemic compression because myopain is an indicator of muscle weakness due to neuromuscular inhibition and a condition called myofascial dysfunction. Myofascial dysfunction is typically caused by an altered kinetic pattern following sports trauma and guarding. In the case of hip myofascial dysfunction, the altered kinetic pattern usually causes an altered walking gait. Over time, this altered kinetic pattern can cause neuroplastic changes in myofascia, marked by painful taut bands called trigger points. Using ischemic compression on weakened muscle tissue does not address the underlying issue, which is muscle weakness. The aim of muscle rehab work is to restore the function of the kinetic pattern. That is why we need to strengthen muscle tissues that are affected by the taut bands. What are taut bands? Taut bands are caused by an increased amount of acetylcholine, whereas the sensation of myopain at the site of the taut bands is caused by alkogenic or inflammatory substances, which include bradykinin, substance P, calcitonin gene-related factor, and reactive oxygen species. In this video, I'm performing on myself a partial demonstration of dry needling treatment for hip myofascial dysfunction. What is dry needling? Dry needling is a special technique that involves the insertion of a thin metal filament into the muscle spindle found in the muscle belly. This stimulates A delta nerve fibers and consequently releases opioid peptides from interneurons in the dorsal horns. These peptides counteract the effects of alkogenic substances and thus produce what I call a neurogenic reset of the kinetic pattern. Needles are left in place for about 10 minutes. After removing the needles, we should follow up with exercises to correct the kinetic pattern. So that's it. My name is Jnanam. I am a physical therapist and I operate a private practice in Sydney. Private health fund rebates are available.